Greetings from IIDL NAPCM. Hi, this is Dr. Piyush Gupta, Secretary and Principal Executive Officer of Cancer Aid Society, which is a member of National Association of Palliative Care for Ayush and Integrative Medicine. So, we are covering about the model of Cancer Aid Society today. Cancer Aid Society is an ISO 9001 NGO having 35 years of national presence since 1987. We got associated with United Nations Department of Global Communication in 2019. We got a special consultative status with United Nations Economic and Social Council in 2012. We are a registered participant of World Health Organization's Global Coordination Mechanism on NCDs. All of us know about Sustainable Development Goals 2030. Here, the goal number 3 is good health and well-being. So, we are working on goal number 3 of SDGs 2030. Keeping up with the Sustainable Development Goals 2030, the goal number 3 is good health and well-being, where good health aims to keep the global citizens healthy and disease free, whereas well-being points towards palliative care, taking care of the sufferings due to various illnesses. This is a group photograph where I participated in the GCM NCD meeting in April 2015 at WHO headquarters in Geneva. This is another photograph where I again participated in GCM NCD meetings in November 2015 at World Health Organization headquarters in Geneva. I got opportunity to represent the country at the high level meeting on NCDs at the United Nations headquarters New York in 2011 and subsequently in its review meeting in 2014. Now, we will be telling about the advocacy initiatives of Cancer Aid Society. So, this one is on tobacco. We started building public support by obtaining endorsements on no tobacco zones, and on our advocacy for amendment of COTPA for 85% pictorial warning, the Lok Sabha Secretariat asked for a reply from us to the objections of the tobacco lobby, which we gave. We gave point-wise reply, and probably this showed that each Adivasi earns a meager of 5,500 rupees every year. That is rupees 15 per day. That shows their exploitation, and it can never be considered as them getting unemployed. Finally, the act was implemented. The amendment of Cigarette and Other Tobacco Products Act in 2015 was finally done. Then we organized over 20 workshops under the grant from American Cancer Society for addressing cancer pain and improving cancer pain policy. Here you can see in the Times of India, we organized a workshop in PGI on oral morphine, and my question which I raised is published in the newspaper. UP was the only state in which the Excise Commissioner issued a circular for easy availability of license by the excise officials to those hospitals who need it. We advocated with the government on availability of essential narcotic drugs. So, our letter to the PMO, they referred to the Finance Ministry, and finally, we were involved in the committee for amendment of NDPS Act by the Finance Ministry, and here you can see that I am part of this committee. And finally, once this act was passed, still for availability of oral morphine and keeping it by chemist was a question which we clarified from the DGCI, and this is his reply to that aspect. Here you can see me sitting in the meeting of NDPS Amendment Act. The Narcotic Drugs and Psychotropic Substances Act 1985 has now been amended and new rules framed in 2015, where Cancer Aid Society was a member of the committee constituted by Government of India for suggesting amendments. However, availability of oral morphine has yet not improved due to lack of implementation by different states. Now, the priorities and strategies for the 8 most common cancers worldwide given by WHO, they clearly say that pain and palliative care is effective in almost all the cancers. Hence, we should follow this strategy. Even prevention is possible and very effective. So, as per World Health Organization, 1/3 of all the incidences of cancer can be prevented. Early detection and treatment can save 1/3 of the cancer patients, and remaining 1/3 can be given palliative care, need of which is over 80% in India. However, only 1% are able to receive it. This is the scenario in our country. So, how do we work? Our methodology is that we integrate fight against cancer, non-communicable diseases and tobacco along with palliative care through advocacy. So, we have earlier seen our advocacy efforts on tobacco as well as oral morphine. We focus on 4 preventable causes of NCDs in accordance with World Health Organization, that is tobacco, unhealthy diet, sedentary lifestyle as well as obesity. The salient features of our programs are: the first step is fixing an appointment for the program from the institutional head, then organizing the training session for the awareness on primary and secondary prevention of cancer, NCDs, tobacco and palliative care. Here we can see the tiny tots attending the programs. We catch them early, and as early as they start volunteering, you can see their baby steps can become major steps in all the activities. Then replicability, distribution of literatures is in different regional languages having do's, don'ts and early signs and symptoms of cancer. We can see this is in Hindi belt, we have the forms in Hindi. We have the forms in English where people do not understand Hindi. Then we have the forms in Punjabi, Urdu, Bengali, Telugu, Kannada, Tamil, Marathi, Gujarati, Assamese, Malayali. So, through these literatures we propagate on the various issues on awareness amongst the kids, teachers and principals. Even for kids we have pictorial forms where you can see that we are trying to teach the tiny tots about the various aspects that include do's as well as don'ts. There are other literatures on various aspects which are given to the community. This is a series of 24 booklets on different cancers. In absence of funding, we integrate the program with resource mobilization too, which has been very effective. We get the support from the stakeholders and we recognize the services of the stakeholders for their effort. Here we can see that we give prizes, certificates, etc. to the stakeholders. Feedback from the stakeholders help us in continuous improvement and innovation. This is the feedback. You will find that all the feedback are appreciation for the program they have given. Additional features of the program are workshops for adults, quiz, painting competitions, slogan competitions, etc. wherever possible. So, we can see community events also. We organize rallies, signature campaigns, advocacy with the government to raise the issue in public to strengthen the fight on the various issues. These are the glimpses of the various rallies, camps in rural areas. You can see that within last 20 years, we have organized almost 25,000 activities covering more than 1 crore population, that is students who have acted as volunteers, and in all we have covered almost 42 crore people till date, and we have also got declared no tobacco zones, etc. What activity we started in 1987, later in 2008, World Cancer Campaign by the world leader UICC was launched in 2008, covering the same issues which we started in 1987, which shows our vision in fight against cancer and other issues way before the world leaders started to recognize the same. We have our networking through a network of branches, that is our head office is in Lucknow and regional offices in Delhi, Kolkata, Ahmedabad, Mumbai, Hyderabad, Bangalore and Chennai. This diagram shows that we have extensively covered these areas where we have our branches, and other areas are moderately covered, and some areas are still left which we still have to cover. We won the Best Cancer Awareness Program and NGO in Can India Conclave, where all the organizations of India, almost 165 NGOs participated at Tata Memorial Hospital, Mumbai in 2013. So, on palliative care, we have organized almost 35 workshops till date, training CMEs on palliative care along with oral morphine in government medical colleges of UP, MP, Bihar, Chhattisgarh, Jharkhand, Tamil Nadu, Punjab and Assam. Our advocacy on oral morphine was instrumental in amendment of the NDPS Act in 2014, which I have already covered earlier. These are the glimpses of the workshops in various medical colleges. The free homeopathic dispensary was sponsored by NTPC, North Regional Headquarter at Lucknow from 2015 to 18, and this helped us in integration and interventions of homeopathy in palliative care with free consultation and distribution of medicines. It paved way for conducting 3 clinical trials in 2020, 21 and 22 successfully in homeopathic combinations. This is the photo of inauguration of that homeopathic dispensary. Homeopathic medicines, we all know, are cost effective and have proven efficacy in palliative care. Also in diseases like migraine, tonsillitis and allergies, where allopathic options are limited, good homeopathic physicians are as expensive as allopathic ones. So, we plan to establish a network of dispensaries for initiating the use of homeopathic medicines in palliative care, which is presently lacking across the nation. Our national helpline 9335166600 is aimed to demystify the disease and respond to the queries related with cancer and guide the cancer patients to the nearest treatment as well as palliative care centers. We got constructed a daycare center which aims to demonstrate that there is always something which can be done even to a terminally ill patient by adding life into the days and not just days into the life, thereby improving the quality of life. This is the glimpse of our daycare center, which has even a swimming pool, and you can see there are various lawns and trainings being conducted in this place. We have several appreciations and recognitions to our credit. We got NGO Leadership Award recently. We got NGO Leadership Award at Lucknow in 2019. We got BWW Inspire Awards and Health and Wellness at Lucknow to our founder Mr. M.K. Gupta in 2019. We got Best Award for Cancer Prevention and National Awards for Excellence in NGOs at Bangalore in 2018. We got Gaurav Samman at Mumbai in 2018. We got International NGO Excellence Award at Thailand in 2018. We got NGO Leadership Award at Lucknow in India in 2017. We got Best NGO in Healthcare at Mumbai, Giving Back 2015 CSR and NGO Awards by UBM in 2015. We were finalists in the America's Spirit of Humanity Awards in 2014. We were awarded the Best Cancer Awareness Program or NGO out of 165 NGOs in Can India Conclave Award 2013 held at Tata Memorial, Mumbai on 19 December 2013. We were finalists in America's Spirit of Humanity Awards 2013. We were awarded the Best NGO in Healthcare at Samagam, IIM Lucknow in 2011. We got appreciation from American Cancer Society USA in 2007. We got appreciation at World Conference on Tobacco or Health USA in 2006. And we got appreciation letter from World Health Organization in 2000 itself. We participated in United Nations and World Health Organization at their headquarters. We represented the country in the dialogue on NCDs at WHO headquarters Geneva in April and November 2015. We represented the country in the review meeting for the control of non-communicable diseases at United Nations in July 2014. We represented the country in the high-level meeting for the control of non-communicable diseases at United Nations General Assembly headquarters, New York in September 2011. We have various membership and empanelments at national and international level to share them. As we are associate of United Nations Department of Global Communications since 2019. We are registered participant of World Health Organization GCM NCD since 2018. We have a special consultative status with United Nations Economic and Social Council since 2012. We are member of International Association of Hospice and Palliative Care USA. We are member of Framework Convention Alliance Switzerland. We are member of NCD Alliance CIG Group Switzerland. We are member of Cancer Service Group ICISG Canada. We are member of National Association of Palliative Care for Ayush and Integrative Medicine. We are member of Indian Association of Palliative Care. We are member of Action Council Against Tobacco, Tata Memorial, Mumbai. We are member of Action Forum on Tobacco Control, India. We are member of National Health Mission, Government of UP as NGO Partner Technical Support Group. We are member of Cancer Control Committee of Government of Delhi. We are member of Delhi Smoke Free Civil Society Coalition, Government of Delhi. We are member of Tobacco Control Committee, Government of UP. We are member of Niti Aayog, Government of India, NGO Darpan, and we have been empaneled with them. We are empaneled with National CSR Hub at Tata Institute of Social Sciences, and we are empaneled with Indian Institute of Corporate Affairs and GuideStar. Thank you.